Durham is a diverse and vibrant community rich with innovation, culture, and history. This half hour is dedicated to Durham living healthy. The program is focused on giving you helpful information to improve our community. Hi, I'm Jana, and welcome to another episode of Living Healthy. This show is brought to you by the Durham Diabetes Coalition, a partnership working towards improving the quality of life for adults living with type 2 diabetes in Durham County. We hope this show gives you the information and tools you need to take charge of your health. On this episode, we're going to take a closer look at one team of the Durham Diabetes Coalition. We'll hear from local health professionals on how to choose healthy foods at the grocery store, why stretching is important to your health, what is myth versus fact about diabetes, and the steps that you should take to get the best possible health care. Let's hear what a longtime Durham resident will tell us about the strategies she uses to manage her diabetes. If you can't write down the information you see during this episode fast enough, don't worry, we'll recap everything at the end of the show. All of the information will also be available at durhamdiabetescoalition.org. The Durham Diabetes Coalition has neighborhood intervention, geospatial, and clinical teams working with the community to cut down on death and injury from type 2 diabetes. Let's meet a couple of people from the clinical team so they can tell us about the work they're doing to impact diabetes in Durham.
A lot of Americans right now are at risk for diabetes, and a lot of people don't know that. The Durham Diabetes Coalition has several different parts involved, and the clinical team, what we're trying to do is really reach those high-risk patients with diabetes and see if we can improve their self-management, improve their diabetes, and hopefully prevent complications and prevent unwanted hospitalizations. The clinical team has 2 nurse practitioners, 2 registered dietitians, 2 licensed clinical social workers, 3 community health assistants, and a supervising physician. The nurse practitioner, dietitian, social worker, and community health assistant are involved in going to the patient's home.
I am responsible for helping the nurse practitioners, the licensed clinical social worker, and the dietitian meet the needs of our patients.
And then we're able to relate that information back to our supervising physician to make sure that the patient's getting appropriate care.
I see myself as a person that I'm doing just that, being the bridge that helps keep the patient and provider connected so that they can help provide the best care for that patient.
We're trying to reach patients that have diabetes as well as other barriers to managing their diabetes that we can hopefully intervene in their home. In the clinical team, it's important to have a nurse practitioner to be able to do home visits, because what we can do is we can do medication reconciliation, and we can review medicine, and we can also, if we need to add additional medicine that patients need, or if we need to change medicines that they're already on, we are able to work with the primary care provider and then the pharmacy and do that. Our goal is for the patient to see the nurse practitioner, the dietitian, the social worker, and the community health assistant. The reason we want them to see everyone is everyone has a little different view and they have a different focus. When they have a different focus, we're able to really see all aspects of a patient's life and where we need to, where we can have the biggest impact.
When I hear the words community health assistant, I think of being a support for those professionals that work with the DDC, and in supporting them, I can help bring the patient's view to the providers and help them to understand what the patient's needs actually are from a home standpoint.
My favorite part of being a part of the Durham Diabetes Coalition is seeing patients take control of their diabetes and have improvement. When they are able to learn something new and they're able to see the improvement and they get excited about the improvement, it makes my job much more worthwhile. We're hoping by using different members of the healthcare team, by using the dietitian, by using the social worker and the community health assistant, as well as the nurse practitioner, that we can prevent complications from diabetes, we can help the patient feel better, and that we can hopefully reduce hospitalizations that are unwanted.
Katie and LaTanya have been working with the other members of the clinical team to improve the health of high-risk patients living with type 2 diabetes. The team is connecting patients to a variety of resources that fit their needs. Patients do need to be referred by their physician and meet certain guidelines to get into the home visit program. For the referral form and more information on the clinical team, visit DurhamDiabetesCoalition.org. Everyone probably knows that being physically active is important to your health. But did you know that stretching is an important component of overall physical fitness? Let's find out why stretching should be a part of your daily routine.
Hi, my name is Louisa Barnett. I'm a registered yoga teacher and certified health coach, and I want to share with you today some benefits of stretching. One is it improves flexibility. So that makes things easier, like tying your shoe or getting something out of your top cabinet. You just want to keep the muscles elongated so that you can use them properly. Another benefit is balance and agility. So you want to make sure that if you become off balance, you can regain your balance easily. Another benefit is releasing lower back pain. So when your hips are tight and your quads are tight, it causes lower back pain. So stretching is an easy way to relieve it. Another great thing is stress relief. Just releasing tension from your muscles naturally allows you to relax. So I'm going to show you 5 easy stretches that you can incorporate right away. So mountain pose. Inhale your arms up, reaching overhead. Relax your shoulders. Pull your stomach up and in. Forward fold. Tuck your chin and fold forward. Reaching towards the floor. If you can't quite touch, that's okay. Just bring your hands on your legs and rest them lightly. And then tuck your chin and drop your head. If you haven't stretched in a while, you may feel some tightness in the back of your legs, and that's okay. Don't push too far. Halfway lift. Inhale, bring your hands up your leg, roll your shoulders back, creating a flat back. So you should feel length from your neck to your tailbone. High plank. And bring your hands in line with your toes. And step back, as far back as you can go. And hold. Wrap your shoulders in, your elbows in, lift through your core. If you need to, you can drop your knees in this pose and still get a good stretch. And lift back up. Down dog. Take your hips back behind you, creating an inverted V with your body. So your arms are completely stretched out. Your legs are straight as you can get them. Your fingers are spread wide. And then finally drop your head and look back behind you. Take your gaze back to your hands. Bend your left knee and step your left foot towards your left hand. And if it doesn't get there in one step, you can shimmy it up, or you can actually take your hand and lift it up. And then bring your right foot to meet it. Halfway lift, chest forward, forward fold, drop the chin and exhale, fold forward, and slowly roll up to standing, one vertebrae at a time. Reach your arms up overhead, back to mountain pose. And bring your hands to your heart center. Release. So you should start stretching every day, whenever you have time. It could be first thing in the morning, when you get home from work, or just in the middle of your day. And there you have it, 5 easy stretches that you can do right away to start feeling better. So get up off the couch and give it a try.
Like Louisa said, yoga and stretching has many benefits. Doing those 5 moves each day can go a long way towards preventing falls, relieving back pain, and providing stress relief. Nutrition is just as important as physical activity in maintaining good health. It can be hard sometimes to know which foods are better for you than others. Next, Kara will tell us what to be aware of on nutrition labels.
Healthy eating is important for everyone. Choosing healthy foods starts with knowing the facts about what you are putting in your body. The nutrition facts label can help you know what is in your food so that you can make wise choices for you and your family. But with all this information, you may be wondering, where do I start? Start with the serving size. All of the information on the rest of the label, from the calories to the vitamins, is based on that amount. Serving sizes differ on each food label. For example, the serving size on this box of cereal is 1 cup, and the serving size on this box of cereal is a half a cup. The label also tells us how many servings are in the container. This is important because even items that seem like they would be a single serving, such as a bottle of juice or a package of chips, may contain more than 1 serving. If you eat or drink the whole thing, you will need to double or triple the other numbers on the nutrition facts label to know what you are really getting. For example, the serving size of this soda is 8 fluid ounces and there are 120 calories per serving. However, there are 2.5 servings in this bottle. So if you drink the entire bottle, the number of calories you consumed would be 120 times 2.5, or 300 calories. The next thing to look for on the label is the amount of nutrients. The nutrients listed in yellow are the ones we generally eat enough of, or even too much. Eating too much fat, cholesterol, or sodium may increase your risk of certain chronic diseases like heart disease, some cancers, or high blood pressure. So when choosing between 2 items, look for the one that contains less of these nutrients. For example, let's look at the label for milk. Whole milk has 8 grams of fat per serving, and 1% milk has 2.5 grams of fat per serving. The food label lets us know that the 1% milk is the lower fat, healthier choice. The percent daily values are the numbers listed on the right-hand side of the nutrition facts label. These numbers can help you decide if a serving of food is high or low in a nutrient. In general, 5% or less is considered low, and 20% or more is high. Remember, the nutrients that we want to limit are saturated fat, trans fat, cholesterol, and sodium. The percent daily values are based on a 2,000 calorie diet. You may need more or less than 2,000 calories depending upon your age, gender, activity level, and whether you're trying to lose, gain, or maintain your weight. Talk with your doctor or dietitian who can help you with your specific goals. With a little bit of detective work, by reading the nutrition facts label, you can learn to make the best choices for you and your family. The key to choosing healthy foods is right here in your hands.
Kara mentioned that paying attention to the nutrition label could help you make wise food choices for yourself and your family. Next time you go grocery shopping, try comparing food labels in order to choose the healthier option. Another aspect of being healthy is making sure you get the best possible health care. In a past episode, we talked about how important it is to prepare for a doctor's visit. Next, we'll see how the visit goes when the patient hasn't prepared versus when she has.
Being prepared for your doctor's appointment is an important part of working with your healthcare team and getting the best possible care you can. Let's look at 2 different doctor's visits with different outcomes. In the first, the patient does not prepare and she doesn't get as much out of the time with her doctor as she could. In the second situation, the patient shows up ready and things go a lot better. Let's join Ms. Smith in the exam room during our first appointment.
Good afternoon, Mrs. Smith. How are you doing?
Hi, Dr. Jones. I'm doing okay.
Okay, so what brings you in today?
Well, I've been having pain in my legs.
Oh, okay. Can you describe the pain to me?
Well, it's in both of them. It starts about here and goes all the way down.
Oh, right. And what exactly does the pain feel like?
I don't know. It's just really bad.
Does it hurt more when you're doing certain activities or during certain times of the day?
I'm not sure. Maybe when I stand for a long time.
Okay. Have you seen any other doctors since you saw me last?
I saw my other doctor and he prescribed me a new medication. Wrote it down. It's in here somewhere.
Don't worry, you can call my office once you find that information and I'll add it to your chart then. There are a variety of things that could be causing the leg pain. Some examples include diabetic neuropathy, myositis, claudication related to PVD, but I will need some additional information and have to run some tests in order to determine the cause.
Okay, what do you need to do?
Well, based on the information that I have today, it's difficult for me to know what could be causing the pain. So I'll need to draw some blood and run a neurological test called an EMG and also a radiology study called an ABI.
Oh, okay.
Do you have any questions?
No?
Okay, well, great. What I need for you to do is go to the front desk so that you can check out and schedule the necessary follow-up appointments. From there, you can go downstairs to the lab and get the blood drawn.
Okay. Thank you, Dr.
You're
Jones.
welcome. You know, and I thank you for coming in today, Miss Smith. We'll get to the bottom of this.
Okay, thanks. Do you think the pain in my legs has anything to do with my blood sugars running high?
Ms. Smith could have done a few things to make sure she got the best possible care, like making notes about when her pain started, how it felt, and when it got worse, and knowing what medication she was on. Asking questions when you don't understand something, the doctor says, can clear up misunderstandings. Now let's see how an appointment can go when Ms. Smith takes all of these steps.
Good afternoon, Miss Smith. How are you doing?
Hi, Dr. Jones. I'm doing okay.
Okay, well, what brings you in today?
I've been having some pain in my legs.
Okay, can you describe the pain to me?
It's in both legs. It starts about here and goes all the way down.
Okay. What exactly does it feel like?
It's a burning pain and it gets worse the closer you get to my foot.
Okay. And does it hurt more when you're doing certain activities or during certain times of the day?
Yes, it hurts when I walk. It started about 8 weeks ago.
Okay.
And it got really bad the end of last week.
Okay. Does it hurt more when you're doing certain activities or during certain times of the day?
It hurts more when I'm walking.
Okay. Well, let's see if we can't figure out what the cause is. Have you seen any other doctors since you saw me last?
Yes, I saw my cardiologist and he told me my cholesterol was high. He prescribed a medication, atorvastatin, and he gave me nicotine patches to help me quit smoking.
Okay. Well, this is very important information for me to know. Both high cholesterol and smoking are risk factors for peripheral vascular disease. And the leg pain could be caused by a variety of things, including diabetic neuropathy, myositis, claudication related to PVD, and even sciatica. But I will need some additional information and have to run some tests in order to determine exactly what could be causing it.
Okay. I'm not sure what you just said, so could you explain that so I can understand it, please?
Sure. I'm sorry about that. Neuropathy is a medical term used to describe damage to the nerves caused by diabetes, and myositis is a term used to describe damage to the muscle. It can have a variety of medical causes, but it is also a common side effect of some medications. Claudication is a term used to describe pain in the legs that is caused by poor blood flow to the legs, and there are different tests that we use to diagnose each condition. And then there's a blood test called a CK that can help determine if there's damage to the muscle. And then finally, there's a test called an ABI, which can help me figure out whether or not you have poor blood flow to the legs.
Okay, so what happens after the tests?
Well, once I get the results, I'll give you a call and then we'll have a second follow-up appointment where we'll discuss what the diagnosis most likely is and explore treatment options.
Okay, so I need to schedule the test, have them done, and then wait for you to call me with the results.
Yes, that's right. Do you have any other questions?
No, thank you very much. You've answered all my questions. This has been a very good visit.
Next time you visit your healthcare provider, remember to do what Ms. Smith did in the second situation so you can get the best possible care.
Ms. Smith got different results in the two scenarios. In the first, a possibly unnecessary blood draw was ordered and she didn't get all of her questions answered. In the second scenario, Dr. Jones was better able to assist Ms. Smith with the possible problem because she was a much more active member of her healthcare team. Ms. Smith was very clear on her role and her next steps. You should be proactive in your health and self-care as you are your best health advocate. The next Durham resident understands the importance of finding a healthcare team she feels comfortable working with and speaking to about her concerns. Let's find out how Miss Juanita manages her diabetes.
There is diabetes in my family. My father was diabetic, and so that possibly is the genetic link for me. But what triggered that was my personal lifestyle choices. Also, the thing that I don't usually share about my story is that I had a daughter that passed away from complications of diabetes. It was undiagnosed, so she was one of the 7 million people living with diabetes who don't know it. She had gestational diabetes and that there was no follow-up. People in our family might have diabetes and they don't know it and we don't recognize the symptoms. So, that's one of the reasons why you should educate yourself and know what's going on. In addition to line dancing to help stay fit, I also walk. I've committed to walk at least 30 minutes a day. Some days I walk 90 minutes a day. Some days I walk 2 hours a day. It just really shows in my blood sugar numbers when I'm doing the walking. I think that's one of the things that anybody can do that. I happened upon a line dance for fitness class at the Downtown Y. And I was like really excited because being from Texas, that's one of the things that we do. We line dance quite a bit. But I never thought about it as exercise. Since I started line dancing, I actually have become an instructor. And the thing that I enjoy the most is actually working with my beginner students and watching them catch the fire, so to speak. They get a lot of social benefit, but they're what we call sneaking in a workout. I found out that I could possibly be diabetic when I escorted my mother to a health fair at her church. There was a nurse there doing blood glucose tests, and she asked me if I would be interested in having my blood glucose tested. She said, "It's free, it doesn't hurt." So I submitted to the test, and the results came back, they were high. So the nurse suggested that I follow up with my primary care physician and be checked for diabetes. I did follow up with my physician. I was referred to a specialty clinic to have a glucose tolerance test done. They tested my blood sugar and it was actually too high for them to actually perform the glucose tolerance test. So they sent me home, and 2 weeks later, I got a prescription in the mail. And there was just a little note said, "Have this prescription filled and start taking this medication." I really was disappointed that the physician's office would just send me a prescription and say, "Start taking this medication." So I kind of ignored that first initial diagnosis, and I spent about a year in denial. The first thing that I thought was I couldn't possibly have diabetes because I don't fit the usual profile. I've always been this size, so I went into denial and I just kind of ignored it. Finally, I did start having some symptoms of what I thought might be diabetes. I started going to the bathroom like frequently throughout the day. And I said to myself, why am I going to the bathroom so much? Because I'm certainly not drinking more fluids than usual. So I went online and saw that that was one of the symptoms of diabetes. So I decided to follow up. I changed my primary care physician, and I started working with a doctor who actually was a member of my church. And so I felt very comfortable working with him, and I trusted his opinion. He was very good about following up with his patients, spending time with his patients and communicating with them what was going on and what was the recommended care plan. I started to change my diet. I did start on oral medications. My A1C is coming down. I'm really pleased with that. I have a care team that encompasses an endocrinologist, a registered dietitian, a diabetes educator, so I've surrounded myself with a good team. I think it's really good for individuals with diabetes to educate themselves and be their own best advocate, because that way they can be part of their own care team. Because in the end, we are the ones who are responsible for changing our eating habits and changing our exercise habits. The care team is not going to do those things for you. They're going to recommend some changes, but we're the ones who have to incorporate those changes into our lifestyle.
Wow, she's really come a long way. Miss Juanita was in denial for the first year of her diagnosis because she didn't think she fit the profile for someone with diabetes. But she had to face the facts and continued her search for accurate information on diabetes. Having the correct information about diabetes can really help you manage your disease and make informed decisions about your care. Next up, I sit down with a local physician to separate diabetes myth from fact. You can find information about diabetes just about anywhere, from books to magazines, internet, and TV. However, some of this information can be misleading. Today on Living Healthy Durham County, we're going to talk about some myths and some facts on diabetes. Today we have Dr. Greenblatt here from Duke Medicine to help us bust some of the diabetes myths and let us know what's true and what's really not. Welcome, Dr. Greenblatt, and thank you so much for joining us today on Living Healthy Durham County.
It's a pleasure to be here.
Now, what is your specialty at Duke Medicine?
I practice internal medicine, which is a specialty that focuses on care of adults, particularly those with complex or chronic diseases.
Dr. Greenblatt, how long have you been practicing medicine here in Durham County?
Well, I've been practicing at Duke for just over 19 years now.
I've had people tell me that diabetes complications are caused by insulin. Can you tell me why this is not true?
Well, insulin is a treatment for diabetes, and often people who've had diabetes for a number of years end up getting treated with insulin because typically we start with just medications that a person would take by mouth. And when a person's been diabetic longer, they're at higher risk for diabetes complications. So sometimes soon after the insulin is started, a person might begin to show some consequences or some complications from the disease. Now, you could imagine a person might then think, well, gee, it must have been the insulin that caused the complications, when in reality, the insulin is helping to prevent complications.
Another widely held belief is that people with type 2 diabetes are more likely to get colds or flu. Can you set this straight for us?
Well, it turns out that they're actually not more likely to get colds or flus, but actually, if they do get a cold, that can affect the blood sugars, and a person's blood sugars tend to go up when they're sick with a cold. And the same is also true for flu or influenza. But in addition to that, a person who has diabetes, if they get the flu, they're more likely to have complications from the flu, such as a pneumonia, than someone who doesn't. So I recommend, and in general it's recommended, anybody with diabetes should get a flu shot every year.
Thank you, Dr. Greenblatt, for joining us today and setting apart some myths from the facts. The information was very helpful. It's that time again. Our 30 minutes of Living Healthy are just about over. On this episode, we've learned more about the work of the Durham Diabetes Coalition's clinical team, how to read nutrition labels, and the importance of stretching to make everyday tasks easier. We also discussed how to be an active member of your healthcare team, how to separate diabetes myth from fact, and met one Durham resident, Miss Juanita, to find out how she took control of her health after getting diagnosed with type 2 diabetes. For more information on the yoga seen on today's program, you can visit peachcobbleryoga.com. All of the information featured in this episode and the full episode can be found at durhamdiabetescoalition.org. You can also call us at 919-560-7600. We'll see you next time. I'm Jana, and this is Living Healthy.